Good morning. My name is Huntyr Schwegman, and welcome to the continued Spotlight on Education presented by Neosho County Community College, where we highlight various programs and events happening each week at NCCC. And in this episode, we're going to be highlighting the wonderful Medical Assistant program during Medical Assistance Recognition Week. Today I'm here with Jen Brown from the Allied Health Department. How's it going, Jen?
It's going pretty good.
Here to talk a little bit about the Medical Assistant program. What can we expect from today's conversation?
Well, I hope that you will learn a little bit more about why this profession is so interesting. Medical assisting just has a lot of variety for people to start their professional career.
So, Jen, we'll just go ahead and give people a little bit of background on you so they know who we're talking to and why we should listen to you when it comes to medical assisting. So, what is your name, your full name, your title, and how long have you been working at Neosho County Community College?
My name is JLynn Brown. Most people call me Jen. I'm currently the Director of Health Information Technology, and I oversee and advise students in medical assistant and phlebotomy. I've worked at NCC for a total of 12 years now.
Yeah, so what is kind of your experience or background in the medical field that you believe makes you qualified to help students and teach students in this field?
Well, if we go back, way back to 1991, my first job was in healthcare and long-term care. And I'm blessed to say that I started in healthcare and I've never left. My experience in long-term care put me in a different pathway from wanting to be a cosmetologist to pursuing nursing. But while in high school, I was in a secretarial training class, and that led me to learn some different things, including medical records, and that really changed things for me. So while I love the non-clinical side of healthcare that health information management provides, I do enjoy helping people. So along the way, I worked as a certified nurse's aide, a certified medication aide, emergency medical technician, and a medical assistant. So outside of long-term care, I've worked in acute care hospitals, private physician offices, critical access hospitals, and Indian Health Service clinics.
Yeah, that is quite a bit of diverse experience, which kind of shows that this career field does have a lot of options and opportunities for different people wanting to do different things.
There is a lot of variety. There's a lot of opportunity. People can start in one aspect of healthcare and find themselves over their career working in so many different places or positions they would have never initially thought of.
Yeah, so for someone wanting to go into the medical field, what makes Neosho County's MAA program unique, or why would you suggest someone join this program over some other kind of healthcare program, or from just directly entering into the workforce?
Well, there's a lot of reasons why NCCC is unique, but we are really dedicated to balancing quality education and efficiency and affordability. So while we offer courses online, we have lab classes at both Ottawa and Chanute. So ultimately our goal is to meet our workforce needs. So we prioritize proper training over profit. We're not a for-profit career college charging students over $20,000 to do an online program and stamp them as qualified to draw up medications and inject people without ever touching a patient. You'd be surprised the amount of students that fall into that trap. But we also collaborate with our industry partners through our advisory board so that we stay relevant, as well as employing instructors that have experience in the field. We also have a strong representation at the state level with our professional organization. These professionals will go out of their way to give our students a sense of belonging as they transition from student to healthcare professional.
For the people who are currently already in the workforce and maybe are looking to come back to school, are there kind of some flexible options for those people? Like, do we have classes online, in person, or are they hybrid? How does that work in this program?
Yes, I have always been proud that our programs from inception have been geared towards the working adult. When I initially came here in 2008, we had already adopted online learning with lab classes in the evening so that students could keep their day job and have flexibility to advance their career without quitting that position. We have kept that format to this day.
For someone looking to break into that new career field, how long does this program take to complete, and what kind of classes are included in that?
So our program can be completed in 3 semesters. However, we work closely with the students. We do have many that attend part-time, so this time frame can be adjusted to meet the individual needs. Our students are trained as a whole medical assistant, so those classes include administrative as well as the clinical aspects of the profession, so they have more job opportunities when they graduate.
For the more clinical side of things, what kind of hands-on learning opportunities do students have, and are there kind of like internships that they can get into after?
Yes, so we have several lab classes in the evenings that students perform hands-on to prepare them for that externship piece. To meet the eligibility of national certification, they must complete 160 hours of externship experience. I think one of the misunderstandings I often hear is when or where is that state exam? And there is no state exam, as their credential allows graduates to be recognized in all 50 states.
In those lab settings, what kind of technology or equipments are students going to have access to? And then when it comes to actually using that stuff, is it up to date and reflective of like what's actually being used in clinical settings today?
We do our best to simulate the real world experience, so we have medical assistant rooms set up with real office equipment and instruments so students would interact with during an appointment. We always have our community partners who are graciously providing us with equipment as they're updating things in their office, as well as sharing supplies such as needles and blood collection tubes. And we also use some software to simulate patient electronic health records.
So you're trying to get that experience basically as close as possible to what they're going to be seeing in their career right after they get done with the program.
That's always our goal. There is a lot of settings that we could never fully simulate because of the complexity of care. It's just such a wide variety. You never know whether your student's going to land that job in family practice or in a specialty setting.
Let's talk a little bit about getting into the program. For students coming into the medical assistant program, are there any kind of prerequisites like previous healthcare experience, or are there any specific academic qualifications like classes needed before you can start? What's kind of that early process look like?
We don't have prerequisites to get started or require a medical background because we do our best to meet our students where they're at. We know that potential students are looking to start or advance their career, so we do an individualized plan for success with them from day one. Students that will achieve the most success are those that do the work, including reading over the information to get a good foundation. They're good stewards of their time, are present when they're in the classroom. Paying good attention to details is important, including reviewing the expectations of the program more than once. Ensuring they're completing their externship hours and meeting graduation criteria is really crucial, so they have access to resources to reflect back on for the entire program to keep them on track.
Let's say I did put in the work, I got all my assignments done on time, I really did learn how to become a medical assistant, What comes next? Like, what kind of certifications are students eligible for after graduation? And do they take any kind of exam for like a CMA or RMA certification?
Well, our program meets expectations for program alignment through the Kansas Board of Regents at the state level, and then the National American Medical Technologist Certifying Agency. So our students are eligible to sit for the National Registered Medical Assistant exam. Now, if students so choose, they could pursue certification through the American Academy of Medical Assistants for the CMA exam through their alternative pathway. But really, the AAMA and AMT have the most rigor of expectations for medical assisting, and we've had a great long-term relationship with AMT. Our program does include the phlebotomy certificate, so upon graduation from medical assisting, students have 2 certifications to start looking to start that healthcare career. But medical assisting is also a great building block to other professions. We have students that graduate and they love medical assisting and that's where they stay, but we have others that pursue a nursing degree, laboratory medical technologist, health information technology, surgical technology. It just depends on if they've found another love from the foundation that they got in medical assisting.
Yeah, so medical assisting can really be used as like a great foundation building block for other programs to just kind of further your career in healthcare, kind of get you going in that direction.
It's a really great low-cost, short-term way to expand your horizons in healthcare. You really get the opportunity to meet so many different kinds of professionals in the field and also just engage with those patients. You'd be surprised how working with certain patient needs might project your future interest in an area. You get a lot of exposure.
You mentioned earlier that students would have to do so many hours of kind of externship work. What kind of local hospitals, clinics, physicians' offices, or other medical settings does Neosho County partner with to get students put in these places and to get those hours completed?
Another reason we appreciate the externship experience is because our students are showcasing themselves as future employees, and often they do get hired during or immediately after their clinical rotation. What the general public doesn't always recognize is that much like CNAs operate under the direction of a nurse in long-term care, medical assistants practice under the license of a physician in the medical office. This is why medical assistants do not invest as much time and money into their education because they do not require separate licensure. We're really blessed that our community partners want to work with our students to give them a well-rounded experience and shape a potentially great future employee. Our program is very broad in the medical assistant scope of practice because there is such a wide variety of opportunities in medical assisting and we can't hit them all. But I love to hear students share their stories about where they're working post-graduation, such as orthopedic clinics, dental offices, university student health centers, and even bariatric centers, to name a few.
Well, Jen, that's all the questions I had for you today. And I just wanted to give you the opportunity to go ahead and let all of our listeners know anything else you think they might need to hear or understand about being a medical assistant before we go.
Well, I think I've explained a lot about why the medical assistant profession is important to healthcare, but it's also really a lot of fun. We learn a lot during lab class. It gives us the opportunity to get out the awkwardness of trying to approach patients, but also understanding why the profession is so important, because medical assistants are really a partner with our providers. They are the first people to talk to the patient. They have the opportunity to build a good rapport, which then translates to good healthcare practice. We have open enrollment for fall and spring, so we try to help students get in when they're ready. We don't make students complete a application and wait for a year. So students can find out more about the program at neosho.edu/medical assistant. I can be reached at my direct number at 620-432-0323, or my email is jbrown@neosho.edu.
All right, well, thank you, Jen, for sitting down with me today. It was a really, really insightful talk about the medical assistant program, and I hope you can get maybe a couple students out of this.
That would be fantastic.
And that concludes the continued Spotlight on Education presented by Neosho County Community College. My name is Huntyr Schwegman, and I'd like to thank you all for listening today. Tune in next week as we highlight more programs and events happening at NCCC. Go Show!